right, hey Chipola Nation, we're here with Dr. Willie Spires. He is the Dean of General Studies and he's over the Social and Behavioral Sciences Department. And Willie, we are both vaccinated human beings, so
Yes,
let's
we
shake
shake
hands.
hands. Okay.
I'm glad to see you. And
Sure, same here.
we're here to talk about the fourth annual Mental Health Symposium.
That's correct.
That y'all have scheduled. And did we have the third, or was the third?
We postponed because of the pandemic.
Okay.
Right.
Okay. So this is actually the fourth one
Right.
that we've had.
Yes.
Okay. And now tell us when this is.
It's going to be on May 26th.
Okay.
From 6:30 in the evening until 9:30 at night.
All right.
We're trying to allow folks who have the regular 8 to 5 jobs the opportunity to be able to come to an evening program.
Okay. Great.
Right.
And it's in the Cultural Center, which if you're familiar with Chipola, we call it the Old Gym.
Old Gym.
So it's on the corner of College Street and the outlet of Indian Circle.
That's correct.
So and it's a great building. And so Willie, now who can attend this symposium?
Okay, it's open to the general public.
Okay.
Anyone who would like to come can certainly come. We anticipate having a number of students to be involved. In the past, we've had students who's actually presented, but this, because it's summer session now,
Right.
and we don't have the large psychology classes, so it's going to be a parental presentation on mental health from a parent's perspective.
Okay.
And we're going to have 8 or more agencies who will be there to provide ancillary services like care and Emerald Coast,
Okay.
this type thing, who will also be there. But it's open to the general public. Whoever
Okay.
wants to come is certainly welcome to come. Now, we are emphasizing, though, social distancing, and we're also emphasizing, the wearing of masks.
Right. Okay. All right. So you can. It's a public event, but you need to feel confident that the guidelines are going to be followed, and it'll be a safe environment.
Yes,
And that is a huge building. That building will hold 400 people.
Right.
So you're probably expecting. You usually have in the neighborhood of 100.
150.
Okay,
yeah.
right. So there'll be plenty of room.
Sure.
People don't have to worry about that.
Sure, that is true.
Willie, I want to mention some of the organizations that are going to be participating. First of all, the Social and Behavioral Sciences Department. That's the department that you're over, and y'all teach psychology and social science and history. What are some of the other courses in that department?
Sociology, geography, religion.
Okay.
We do world history and American history, just a plethora of different social and behavioral sciences
Okay.
courses. And we have a variety of different psychology courses like general psychology, abnormal psychology, personality psychology, industrial psychology,
Okay.
etc.
All right. Okay. And then the Jackson County Health Department, of
Yes.
course, will be attending. Panhandle Area Educational Consortium.
Yes.
From Chipley. Veterans Outreach.
Yes.
Is another. Emerald Coast Behavioral Hospital.
That's correct.
Is that it? Where is that in?
That's in Panama City.
Okay.
Now, they also have an outpatient office here in Mariana as
Okay.
well.
Now, where's that?
Outpatient. It was out near the Blue Springs entrance.
Okay.
Yeah.
Okay. And then now, what is Child Find?
That's a new agency that I'm really not that familiar with in terms of what they specifically do, but they called and said they would like to be a part
Okay.
of the symposium, so we said, come on.
Absolutely.
Yes,
Okay.
right.
And I'll go ahead. I'm just running down my list here.
Okay.
Go ahead and give out the phone number 718-2319.
Okay.
And that is
Ms. Morales, Linda Morales.
Linda Morales. Okay. And
Right.
so she is your girl Friday, and if anybody has any questions, they can call that number to find out anything
That's correct.
about this event.
Yes,
Okay.
that's correct.
Now, you and I had talked before we started today about, our area. Not only have we gone through the pandemic like everyone else for the last year, but we also had the challenges related to Hurricane Michael, which was in October of 2018.
Right.
And I had talked to a physician who said that the incidence of heart-related visits to the ER had quadrupled over the past couple of years. Have you seen the same spike in mental health issues since Hurricane Michael?
Yes, we have. A lot of people who are having anxiety-related issues, depression, adjustment reactions because of having to move to different locations or having, in some cases, no place to go to.
Right,
you
right.
know. So we've seen an uptick in the number of referrals that we're getting from primary care physicians because when you look at mental health and physical health, they're inseparable. People who may think that they're having heart-related issues may be presenting with those symptoms because they're suffering anxiety or panic attacks, etc.
Okay.
So yes, there has been an uptick in that area.
Right. And I think, Willie, one of the things that we always are trying to do with events like this is we're trying to remove some of the stigma.
Yes.
Because I know I know in the South, I think a lot of times men are supposed to say, doggone it, just pull yourself up by your bootstraps. Everything's going to be okay. Just work a little harder.
Yes.
And sometimes that's just not possible.
Very true, very true. There is a tremendous difference in the number of females who come in for mental health services as compared to males. Okay, males typically won't come until things are almost at the point of not being able to fix.
Right.
Okay.
Right.
The macho type attitude.
Right.
As far as females are a lot more open to mental health services. Oftentimes, when you have one person in the family has a mental health issue, it affects the entire family. Okay. So sometimes it's hard to get the males to come in. But I opened a private practice 12 years ago, and since that time, I've actually, the last chart that I opened represented 1,598 people who've come through my small agency.
That's amazing.
Yes, so stigma has been eradicated to some degree. We still have some work to do.
Right.
But more people are realizing that if I have mental health issues, I go see a mental health professional. And if you have a legal issue, you see an attorney.
Exactly.
If you have a physical issue, you see a physician.
Right.
So it's just one of those type things. But oftentimes, people who still hang on to the stigma won't come until they're in a crisis situation.
Right.
And it's like having a physical illness. The sooner you treat the problem, the better the prognosis.
Yeah, absolutely.
Yeah.
Willie, I wanted to ask you. You mentioned you've had a private practice for 12 years. How long have you been with Chipola?
34 years.
30?
Yeah, January will be 35.
Okay. And so you teach. What are the courses that you've taught here over the years?
I would say all of them. I've taught. Well, when I first came, I taught 2 classes in sociology.
Okay.
And I taught 3 classes in general psychology. Since that time, I've been teaching basically abnormal psychology, general psychology. I've taught child psychology, human growth and development, personality, the whole gamut.
Right. Now, who was your psych teacher at Chipola? Do you remember?
Mr. James Gage.
James Gage.
Gage.
I remember the
him?
name. I never knew him, but
Right.
I had Mitch Grabois, who looks just like Richard Dreyfuss in Jaws. He had the little round glasses and the beard, and I thought he was the coolest person that I had ever because I know that your students have experienced this. So many of us who are not familiar at all with mental health, when you start talking in general psych about all the disorders, it's fascinating, and of course we all know that we have a cousin or somebody who has some of these things, and it's always just a really a very, very interesting class.
Sure.
Yeah.
I always tell my students that we all are affected by mental health kind of issues, either directly or indirectly, either family members or friends or even ourselves in some cases, or if not directly, indirectly by being a taxpayer, people who can't afford the mental health care, we contribute to that tax base to help provide services for them.
Right.
So,
Now, I don't want to jump around too much, but if someone is having a mental health issue, and let's say they have a regular general doctor, would a GP be able to steer a person to some help?
yes.
Okay.
We get a lot of referrals from individuals, primary care physicians. We realize you're having this issue with cholesterol or anxiety or whatever the case may be, or heart kinds of issues, and we think that counseling would be a benefit.
Right.
And typically, or post-traumatic stress disorder.
Right.
And most times when the physician refer them to a mental health care professional, they will follow through.
Okay.
They will follow through.
Good.
Yes.
And Willie, I want to bring it back to Chipola. We have an association here with a mental health outfit. Who do we use right now with?
Okay, I think it's called Baycare.
Baycare,
Baycare.
And obviously they're in Bay County, which is somewhere in Panama City, I assume.
Right. I think there's a ancillary office also in Tampa, St. Petersburg area.
Okay.
Right.
And so, if a student at Chipola is having some issues and they feel like they need some mental health help, they can contact Student Services here, and we can direct them to get some services that I'm pretty sure the college covers that as a,
Sure.
as a part of the services that we offer to students.
Right. I believe I'm correct, Brian. I think if a student has a mental health issue, they will contact Student Services, and Student Services will contact Baycare. And I think that they actually will pay for 3 sessions.
Okay.
And then after that, typically the student's personal insurance, will take
Okay.
over from that point of view. But Baycare, typically will call a private practitioner and say, we have this individual who is experiencing whatever anxiety attacks or whatever, and they'll make a referral to a private provider who will provide the services.
Okay.
Yeah.
All right. Great. Well, let me see, Willie. I wanted to see how long we've been talking because
Okay.
we said we wanted to keep this. We've been talking 11 minutes.
Oh, wow.
So, is there anything else that you would like to say about the Mental Health Symposium on Wednesday, May 26th?
Okay. I would just like to say that, as I said earlier, that everybody is certainly invited to come out and partake in the activity. And if you have any specific questions, Mr. Morales' phone number, as we mentioned before, is 718-2319, or you can call me. My number is 850-718-2232.
Okay.
We hope to disseminate a lot of information, and if we can't provide direct information about direct mental health issues, there's going to be someone there from alcohol services. There's going to be someone there from, as we said, child find services. We have a veteran services officer who's going to be there as well. So we will invite everybody to come out. We should have some services that everybody can benefit from.
Okay. Great. All right. So May 26th, the 4th annual Mental Health Symposium, and we look forward to seeing you all there.
Sure. Fine.
Okay.
Thanks for having me.
Willie.
Appreciate
All right.
it very much.